Welcome to Capsule RN, where nursing school just got easier.
Meet Charlie, a young professional who has come to the urgent care with signs and symptoms of the flu. Charlie's temperature is 101.3 Fahrenheit. Charlie is an overall healthy individual with no pertinent health history to note. What recommendations would the doctor likely give Charlie for managing his fever? Is the answer A, limit fluid intake, B, take an antipyretic, C, exercise, or D, use many blankets? To answer this question correctly, we first need to understand some things about temperature. So let's get started. What exactly is temperature? Temperature is the measurement of the body's ability to regulate heating and cooling. The hypothalamus in the brain acts as a thermostat of the body. It knows the normal temperature of the body, which is around 98.6 Fahrenheit. And if it senses the body is becoming hotter or colder than it should be, it takes action to maintain homeostasis, that state of balance where everything is right again inside the human body. This is how it works. If the hypothalamus senses the body is getting colder than it should be, it signals to the blood vessels to vasoconstrict. Vasoconstriction limits blood flow to the skin's surface, so more body heat stays inside the human body. The hypothalamus also signals to the skeletal muscles to shiver. Shivering causes muscle cells to work hard, contracting and relaxing, and this produces energy that warms the body. On the other hand, if the hypothalamus senses the body is getting hotter than its set point, it signals to the blood vessels to vasodilate. Vasodilation helps blood flow closer to the surface of the skin so that excess body heat can escape into the environment. This helps cool the body down. The hypothalamus also signals to the sweat glands to activate sweating. Sweating allows body heat to escape into the environment via evaporation. This too helps cool the body down. This process of temperature regulation in the body is called thermoregulation. Getting a patient's temperature is vital as it is a sign to help you better know if the patient is healthy and in that state of homeostasis or struggling from an inside or outside influence and trying to regain homeostasis. When we take a patient's temperature, we need to mentally be able to place that reading in a category so we know what action, if any, we need to take next. When discussing temperature, there are 5 categories to discuss: hypothermia, normothermia, fever, hyperthermia, and hyperpyrexia. Let's talk about each of these. The first category is hypothermia, which is an abnormally low temperature. Remember that the prefix hypo means low or less than normal. If your patient is abnormally cold based on their temperature reading, they have hypothermia. The second category is called normothermia, and it means the patient has a normal temperature. For an adult patient, the normal average temperature will be 97 to 99 Fahrenheit. But a patient can have a temperature between 96.8 up to 100.4 Fahrenheit, and it still be considered quote-unquote acceptable. This larger range factors in 3 key things. 1 is individual baselines. People are not all the same. Normal will be slightly varied from person to person. 2, temperature site. The site the temperature is taken can yield slightly higher or lower readings. For instance, an axillary site will yield the lowest reading, an oral site a mid-range reading, and a rectal site the highest reading. And then 3rd, the age of the patient. A young child will naturally have a higher temperature than an adult, for instance, whereas many elderly individuals often have lower body temperatures as their baseline. The 3rd category we will simply call fever. In the medical world, a temperature of 100.4 Fahrenheit or greater is considered a fever. Remember that, 100.4 or greater. With a fever, the hypothalamus temporarily resets the body thermostat higher for some reason, such as to fight a pathogen. If your patient has a fever, they are said to be febrile, and if they do not have a fever, they are said to be afebrile. Even if your patient has a fever, be aware that a fever is not typically dangerous until it gets to around 102 Fahrenheit or higher. It is important to note that a patient can have a temperature reading that is higher than their normal baseline, say 99.4 Fahrenheit, but not yet a true fever of 100.4 Fahrenheit. This reading is still important to take note of, though, because the trend is moving up for this patient. Trends help you to detect issues early for your patients and notify the doctor, assess the progress of your patient's health with ongoing treatments, and make good nursing decisions moving forward. The 4th category is hyperthermia, which is an abnormally high temperature. The prefix hyper means above or higher than normal. With hyperthermia, thermoregulation is now failing. The body temperature is above the hypothalamus' set point. The fifth category is hyperpyrexia, which is an extremely high temperature. To summarize, the 5 categories in which you need to be able to mentally place your patient's temperature reading are hypothermia, normothermia, fever, hyperthermia, and hyperpyrexia. If there is any temperature reading that is not in the normal range, notify the doctor and take all appropriate actions. Continue to reassess your patient with all treatments, monitor temperature trends, and don't forget to chart all of this. When taking a patient's temperature, there are 3 main factors that can produce a higher or lower reading than normal: the environment, physiology, and substances. First, the environment can alter body temperature. For instance, if your patient is under 3 warm blankets, their temperature at that moment will likely be higher. On the other hand, if your patient just walked into the clinic after being outside in cold, snowy weather, their temperature will likely be lower at that moment. Be aware of the environment the patient is currently in and the environment the patient just came from. Second, physiology can also affect body temperature. Things going on inside the body like infection, blood clots, neurologic injuries, thyroid issues, aging, glucose levels, and physical exertion from exercise can all affect body temperature. Lastly, substances can affect body temperature. Medications like anesthesia given for surgery, toxicity or too much of a certain substance, and withdrawal from drugs and alcohol, for instance, can all affect body temperature. The healthcare team will try to determine if any of these factors are the reason for an abnormal temperature, and as that root cause is cured, if possible, the temperature will return to normal as well. Let's next talk about some basic treatments and nursing interventions if your patient is too hot or too cold. If our patient is too warm or has a fever, we are going to obtain any blood, wound, or urine specimens if the doctor has ordered them, and we are going to do that before starting any ordered antibiotics. This is very important. Specimens are obtained to see if there is any infection in the body that's leading to the fever. Once an antibiotic is given, however, it begins changing the flora in the body, making it harder for the lab to correctly identify the harmful pathogen. We are also going to limit our patient's activity because exertion and activity only increase a patient's temperature. We are going to remove any excess blankets because that's just trapping heat close to the patient's body. We're going to apply a damp cloth to their forehead to help cool them. And we're going to regulate the room thermostat to make it a little cooler, but we don't want to make it so cold that it induces shivering because shivering will only increase the patient's temperature. We are also going to increase the patient's fluids unless that is contraindicated due to other health conditions the patient has. And lastly, we're going to give an antipyretic medication if the patient has a fever, if that is ordered. An antipyretic medication reduces a fever. Examples of antipyretic medications are acetaminophen or Tylenol and ibuprofen. If our patient is too cold, on the other hand, some things we are going to do are to remove and replace any wet clothes or bedding with dry ones, warm their environment using warm blankets, and we want to give them warm soups and fluids to drink to warm their body, unless again that is contraindicated because of other issues such as heart or lung issues where they have fluid overload. There are 5 common sites where a nurse can take a temperature: oral, axillary, temporal, tympanic, and rectal. So why would you choose one site or method over another? First, it depends on what equipment you have available. You may have 4 oral thermometers on your floor, for instance, but no temporal thermometers. It also depends on the age of your patient. An adult will likely be able to keep a thermometer under their tongue, but a young child probably won't. Axillary, tympanic, or temporal options would be better for a younger child. In addition to that, it depends on the current circumstance of the patient. If your patient just had ear surgery, taking a tympanic temperature in that ear is not going to be a safe option. Or if a patient just drank cold water, taking an oral temperature reading won't be accurate. Lastly, it depends on the easiest, least invasive method available that can provide the most accurate result. Remember Charlie? What recommendations would the doctor likely give Charlie for managing his fever? Is the answer A, limit fluid intake, B, take an antipyretic, C, exercise, or D, use many blankets? If you said B, take an antipyretic, you are correct. Antipyretic medications such as acetaminophen, also called Tylenol, will help reduce Charlie's fever.
Thanks for being part of the Capsule RN community. If this video added value to your studies, please hit the like and subscribe buttons. We are excited about releasing more and more content in our continued pursuit of making nursing school easier.